Okay, so we are live. Okay, hello Dr. Abhishek. Thank you for joining the live. Hello Dr. Bishnoi. So hello to everyone and a very good evening.
Hello, Mr. Sahil. Okay. Hello everyone and very good evening, Dr. Saab.
Good evening. How are
कैसे
you?
हैं आप? I am fine. What about you?
All good.
Okay. So before starting the live, let me introduce you. So this is
Hi.
Dr. Anwesha Mukherjee from Kolkata, and she's a seventh generation Vaidya from her family. And currently she is working in SVS Marwari Hospital as Ayurvedic consultant. So जो भी कोलकाता से हैं and those who want to take Ayurvedic consultation, they can visit her or they can DM her to get online consultation. Okay. So good evening everyone and happy Eid and happy Parshuram Jayanti to everyone. Okay. So today we will discuss about the topic of epistaxis that is very common in summers जिसे हम normal language में कहते हैं नक्सीर का फूटना या nose में से या oral orifices में से जो है bleeding का होना. So today doctor will explain about epistaxis in detail, both Ayurvedic and modern perspective. So जो भी questions हैं please write down करें. And so from now onwards, please start, doctor. Okay.
Now, epitaxis, I think it's a very uncommon term for all the means the people who are not belonging to the medical line. It's nothing.
जी.
The epitaxis is the medical term of nasal bleeding. When one is having nasal bleeding, that thing in medically known as epitaxis. Okay. There
जी.
are two types of epitaxis. One is anterior, another one is posterior. Most common is
जी.
anterior, and most uncommon is posterior. And posterior is the most serious one. It needs the emergency immediately. Okay, anterior one is like
Okay.
when you are having bleeding from the this part of the nose. Okay, and posterior is like deep inside the nose. Like if you are having any blood vessels which got cut up due to any reasons, like there are many reasons. I will go to that thing later on. But when the
Okay.
deep nose, when the blood vessels of the deep nose, the posterior on side of the nose gets cut, that time happens the posterior bleeding, which is very, very serious. How can one understand that it is posterior bleeding or anterior bleeding? Okay. Posterior bleeding, if you are having bleeding more than 20 minutes, and if your blood is not getting clotted, we know that when our blood comes out, it becomes clotted uh, due to the bilirubin. I forgot the thing. Okay. So if your blood don't get clot within 20 minutes, and if you're having a bleeding more than 20 minutes, am I audible now?
Yeah. Perfect.
Okay.
Yeah.
So if you're having bleeding for more than 20 minutes, then you are having, for sure, you are having posterior bleeding, posterior nasal bleeding. And if your blood getting
Okay.
clot very easily, that is anterior bleeding. Anterior bleeding can be
Okay.
controlled very easily at home. It can be controlled with posterior bleeding. If you are having bleeding more than 10 to 20 minutes, that means you have to rush to the hospital to stop your bleeding, because means you cannot stop the bleeding at your home easily. Okay. Then
Okay.
comes, I will discuss then that is epitaxis according to Ayurveda. Okay. So it is mentioned in
जी.
Ayurveda also, but in different name. There is a term, there is a disease in Ayurveda mentioned, that is Raktapitta. Raktapitta, there are
जी.
two types, Urdhvagata and Adhagata. Urdhvagata means the bleeding, the Raktapitta means the bleeding disorders. So the bleeding which is coming from the upward side of our body, that is from our nose, from our ear, from our eyes, or from your mouth, that is known as Urdhvagata Raktapitta. And in Urdhvagata Raktapitta
Okay.
also there is Nasagata Raktapitta. So there is a different line of treatment for Urdhvagata Raktapitta, and in Urdhvagata Raktapitta, there is a different line of treatment for Nasagata Raktapitta mentioned in Ayurveda. In Charak also, it is mentioned the different, there is a different chapter for Raktapitta. There is a different chapter with where there is mentioned of Nasagata Raktapitta, that is the Epitaxis in modern term. Okay. There are many causes of epithelius. I will come to the cause directly. I'm coming, okay? Because nothing to tell about the epithelius. Moreover, everyone knows that it's a nasal bleeding. The term may be the uncommon for everyone, but moreover, everyone knows that it's nasal bleeding. The cause. Everyone, when someone is having nasal bleeding, they may not be knowing the cause. Or in our house, if anyone is having, they may not be knowing the cause. First of all, see if the person is, if it's a small children, because small children are mainly prone to this nasal bleeding epitaxis, because they have a habit of pricking the nose, and they have a habit of putting some pencils, pen inside the nose. Means the sharp objects, if you're putting inside the nose, of course your the blood vessels will be ruptured and it will start bleeding. So in children, you can rule out the cause for the pricking the nose, and for the means the putting any sharp object inside the nose. And another thing, there is in adult, maybe it is seen on some children also, it is seen, that is in children who are going to the school, getting blown up with in the nose or in the cheek region. That time also nasal bleeding occurs. Also, because it is due to the injury to the nose, okay? That's why the nasal bleeding occurs. And after that, there is another thing, that is the cause. It is upper respiratory tract infection, which I had. It is very uncommon in COVID. Who have suffered from COVID, it is one of the complication is seen in COVID, that is upper respiratory tract infection. In COVID, there is a what happens after you're getting means you're getting negative reports, you're negative, you're no more positive. But even after that, your body is not getting cured. Your body is not getting 100% healthy. But we don't know that our body is not healthy. We don't, as a doctor, even we don't have time to look after our body, because we seriously don't have time to go for another city. Really, I never thought of going for another city. How is my lungs? I will see. I never thought of that. Means one day what happened? I was reading and suddenly the nose started bleeding, and I was so scared about that. Means even after 10 minutes, it was not stopping. I was so scared. I ran to the nearby hospital emergency, and they just put a nasal plug inside, and it got stopped. Okay. But after that, when I visited a ENT specialist, he told me that you're having upper respiratory infection, which is a complication of COVID. You had COVID? I told, yeah, I had COVID. So he told it's very common. It's one of the complication of COVID nowadays. Means upper respiratory tract is one of the cause for epitaxis. Yeah. Another thing that is sinusitis. Okay. So the upper respiratory tract infection, if you want to do a diagnosis, differential diagnosis, you have one disease, that is sinusitis. Okay. In sinusitis, what happens? The nasal means the sinusitis mainly get triggers in the hot time, because in the summer and in the winter. In severe summer, means it's very hot. Few days back in Kolkata, we was the loo was flowing, so it was very hot here. And in winter time also, when it is very cold, the cold wind blows, our sinusitis gets increased. That time also the epitaxis occurs. And another cause which is very common among the adult, that is hypertension. If you are having a high blood pressure, you are surely going to have a epitaxis. Surely going to have a. Means it is mostly seen in hypertension patient that they had once in a lifetime, they will suffer from epitaxis. They will suffer. So,
Okay.
and another thing that is a high altitude. We living in Kolkata, we are very low altitude person. If we suddenly go to the
Yeah.
high altitude in a very winter, means we are living in a very hot weather, and we are suddenly going to the high altitude where oxygen level is very low, very low. There will start
Yeah.
nasal bleeding will start. So another that is thing,
Okay.
and another one is very uncommon, that is blood thinning drug. Who are on blood thinning drug means who are having a heart disease, they are on a blood thinning drug, so they may be experience this. Okay.
Okay, so basically there are multiple reasons, and normally हम लेके चलते हैं क्योंकि there is some trauma to the nasal vessels here only. That is the
Yeah,
main cause. But sometimes the cause is something else.
yeah,
Maybe in our diet, or maybe we are taking some medicine or a change in lifestyle. So basically, in the patients who have reoccurrence of epistaxis, they should look after the deep causes. Like after leaving the nose, they should look after like which medicine they are taking or something else, or change in the lifestyle. Maybe some person who shifts from Kolkata to like upper areas, like in
uh,
Punjab side, then they can suffer. Or the person who is living in cold weather, if changes to the hot weather, then they might face the epistaxis also.
yeah,
Okay, so as per Ayurveda, we say that there are some diet patterns that we have to follow, that there is some diet that we have to restrict. So, if there's any preference to follow in diet, like what is your advice on the diet point?
yeah.
Like
In
which diet
Ayurveda,
causes the epistaxis?
In Ayurveda, that is mentioned in Charak Samhita. That is, if you're suffering from Raktapitta, you must not have Ushno Ahar. Means you must not have warm food. You must be on Shita Ahar, Sita Jal. Means you must be on cold food, cold, cold water. That does not mean you are going to drink water from fridge or ice cold water. Means room
Yeah.
temperature water. Yeah. Another thing that is mentioned in Ayurveda, that is you must go for Langhan. When you are suffering from
Okay.
Raktapitta, when you are having your nasal bleeding, don't go and drink or don't go and eat the immediately. At least don't eat for 4 hours. Just give your means just take a rest. Don't eat anything.
Okay.
In Ayurveda, it is told to Langhan, told for Langhan in Raktapitta. Yeah. In
Okay.
modern, there is told if you are having nasal bleeding, pinch your lips area very too tightly unless and until your bleeding stops. And sit straight,
Okay.
leaning your head like this, not like this. If you're leaning your head backward, your blood will flow to the head, which will be very, very dangerous. So let your blood out.
Okay.
In Ayurveda also, it is told same thing is told in Ayurveda, that if you are not allowing your blood to come out, there will be lots of diseases are there, which will occur due to Raktapitta Stambhan. Like there are
Okay.
Gulmo, there are Shitra, Kushtha. These diseases can occur if you're not letting your nasal bleeding to come in, if the blood is not coming out slowly. That this is known as Dushita blood. Is the impure blood. If your impure blood is not coming out from your body will get impure again. That's the thing.
Yeah.
Uh,
So basically, there are
and
some mistakes that we do. Like if someone is having epistaxis and they try to hold their bleeding, or they try to lay down. So I think that is a mistake. Okay, as per Ayurveda, if we say. कि अगर किसी को nasal bleeding होता है तो हमें लेटना नहीं है. You should never lay down.
yeah,
You should always sit straight and look still. Right?
look straight and the head must be lean down, like this, and pinching the nose until
Okay.
and unless your bleeding is not stopped. That's the thing. And
Okay.
in modern, that is told that is if you are suffering continuously from this epitaxis, you must be on diet rich in vitamin C, vitamin K, iron, and calcium. You must be having, because
Okay.
when your blood is coming out, you are going to suffer from anemia because your lack of RBC, there will be lack of hemoglobin. ultimately you will suffer from you ultimately will suffer from anemia, right? So you must be on iron
Yeah.
rich food, you must be on vitamin C, vitamin K, calcium, iron, zinc rich food. Like you must drink milk, amla, orange, these citrus fruits which are rich in vitamin C. This must be taken. And another thing I must means I used to follow, that is when I had suddenly I had one day epitaxis, but only one day. After that, I didn't experience that. So I
Okay.
started drinking milk and honey, which showed a very good result in me. Like I was having an upper respiratory infection, which was cured within 2 weeks. It was cured. I didn't take any antibiotic, anything. Means he did a very wonderful work in that. So one who is suffering continuously, having a very chronic thing, chronic epitaxis, please drink a glass of milk and drink a warm milk. It must be, because in epitaxis, I
Okay.
told before that you must not drink warm food. But if you're having chronic epitaxis, you must be on must drink warm milk, not cold milk. And he must also be warm, slightly warm. Ghee you must drink at least for 7 days. After 7 days, stop the ghee. And another thing
Okay.
I like to tell that a spoon of gulkand, which will decrease the pitta of our body, because in Raktapitta, the pitta of our body gets increased, the temperature of our body gets increased. So if 1 teaspoon of gulkand, chawanprash, which will increase our immunity, and the coolness of our body will be there. Yeah. Another thing is
Okay.
mentioned in Raktapitta chapter that is very interesting, I find. That is, you must
Yeah.
settle beside the pond or river, because your body is very warm. So you must settle in a place which is very cool down. And it is also true that the Mritika Griha, like mud house, it's not possible nowadays to live in a Mritika house. We all live in AC nowadays. And another thing I will
Yeah.
add on, use a humidifier. Who are suffering chronically from this epitaxis, use a humidifier, because if you are having very dry weather around you, you can have epitaxis. So just use a humidifier in your room.
Okay. So, as per your advice, if you want to suggest 5 dietary prohibitions, like ये चीजें नहीं लेना है. So, what will be those prohibitions? Like these are the basic don'ts of epistaxis. What are those basic don'ts of the epistaxis one have to follow?
Yeah, basic don'ts like don't overwork out. Who are doing over,
Okay.
they're going to gym and doing over workout, lifting weight which is more than his or her body weight, you will be having
Okay.
epitaxis. You will be having. So don't overwork out. Another thing is,
Okay.
uh, if you are living in a very dry weather or in a very cold weather, don't eat anything that is very dry, which will make your body dry. Eat or drink that food which will make your body moist. Because if your body is dry,
Okay.
epitaxis will occur. Drink or eat anything that is moisture. That's why I told that drink a teaspoon of ghee every day, because ghee will moisturize our body. That's the thing. And
Okay.
another thing for the don't to avoid in epitaxis, that is Ratri Jagaran, which is very much essential to not to do in epitaxis, because if you are staying awake at night, your vayu will increase, your body will get rukha, and epitaxis will occur. And this is one of the most common cause nowadays.
Okay. The top three don'ts are don't overexert yourself and don't take excessive dry items and do not stay awake till late at night.
Yeah,
Okay. And if you want,
another thing I will add. Those
yeah.
who are on alcohol and in cigarettes, in smoking, avoid smoking, avoid alcohol, because this will dry your body. This will thing.
Okay. Like if in the food, if you want, like if you want to suggest some items that are dry in nature, like you are saying, avoid the things that are dry. But if someone is a very layman person who is not from Ayurveda field, how can they distinguish between a dry food item or a moist food item? Like, can you please give some examples of the dry food items they should avoid, typically with their names?
Mm-hmm. Yeah. Dry fruits
Yeah.
items like the caffeinated drinks, the coffee, the tea, not the tea of ginger and all those. Tea means the milk tea, caffeinated drink like the coffee, cold coffee, hot coffee, whatever the coffee is. Don't drink coffee.
Okay.
Alcohol, smoking. Okay. Another thing is nowadays, which is very craziness, that is milkshake. It will dry
Yeah.
your body. It will. And foods like the junk foods, it will dry your body. There is nothing like junk food which does more harm to our body than staying awake at night. Eating a pizza will do more
Okay.
harm than staying at night. Yeah. And
Okay.
foods with foods that will drive our body, there are lots of foods. These are the most common foods actually. People
Okay.
take a cup of coffee every time. So I
Yeah.
this must be avoided. Cold
And
drinks, this
yeah,
will avoid.
yeah, I want to add one more thing here. Like in Punjab, basically, I see this. Like people see that okay, the person is having epistexis, then please have curd because they think the curd is cooling in nature. But I think curd will increase the causes of epistexis. So the one thing one should avoid, including all these things, is curd
Yeah,
because curd causes epistexis more. So this
that
is, I
is
think,
what.
a misconception
Yeah,
in the laymen that curd is a good cure for epistaxis. So they continuously feed the person of epistaxis with more of the nidan. I feel like this is I see in my clinic that people take curd regularly. They say that even I am taking curd regularly, I am having epistaxis. When I say that okay, this is a myth that curd is cooling in nature, please stop having curd.
yeah.
It is the main cause of your epistaxis. So this is a main, I think, a myth going on in the public that curd is cooling in nature. So, if you want to suggest some 5 items that one should add in their diet to avoid having recurrence of epistaxis, what will be that? 5 things to avoid having epistaxis. The
Five
food
things.
items.
Another time. Can you repeat?
Yeah. 5 things to stop the recurrence of epistaxis. Like they are good for the body.
Oh, okay. Five things like
Five,
I
like
told.
5 must to add things. Yeah.
Mhm.
5 must to add things in the diet.
Yeah, I told before also, that is food that is rich in iron, food that is rich in vitamin
Okay.
C, vitamin K, iron I told, for calcium. This must
Ji.
be added in our diet. So, and also milk and ghee is very essential in our body for making our body moist. And another thing I will, should I tell the home remedy now?
Yeah.
I
Please.
just remembered this. That is a, you are going very candid. We are going, yeah,
Yeah, yeah.
yeah.
The
Uh,
total candid life.
Vaseline is available in everyone's home. Vaseline. Okay. The petroleum
Yeah,
jelly.
Wesley. Yeah.
The petroleum jelly.
Ji.
When you are bleeding, this part of our nose getting very dry. So when you are bleeding, this part of our nose gets cut. More and more cut will happen. So to avoid that,
Okay.
apply Vaseline in this part of the nose. When you're having nasal bleeding, or if you experience epitaxis very often, apply Vaseline in this part of your nose so that these parts don't get cut and it remains moisture. If your body holds the moisture, you will not experience the epitaxis. So Vaseline can be another
Okay.
thing to be added in your day-to-day life to avoid this epitaxis.
Okay, so I think from this petroleum jelly, I'm getting the idea of nasir. So one can go for nasir, like,
Of
right? We
course,
can do nasir therapy regularly.
nasha therapy can be done, but under medical supervision, of course, not to be done in home.
Yeah. And what are your opinions about the Jal Neti? Will it help or not?
Of
Jal
course,
Neti will help in this or not?
Jal Neti, Sutra Neti, Dugdha Neti, this will be very helpful in home in epitaxis. But again, this all must be done under medical supervision. But this can be very harmful if you are not doing it in a proper way. Pranayam can be very useful. Anulom, Vilom, Shitali Pranayam, Brahmani Pranayam, these all are very, very helpful in epitaxis. Anulom and Vilom is found to be very, very beneficial in epitaxis because it helps our body to cool down. Because when you're having
Yeah,
epitaxis, your body warms up and you're having a very anxiety also one feels when they are having epitaxis. Gets very panic now.
yeah.
Okay.
Also,
Um,
okay, so in pranayams, there's one pranayam known as Surya Bedi pranayam and Kapal Bhati also. Can we do those pranayams also, like in epistaxis? Like Kapal Bhati increases the pressure of the body. So, what is your view on that? Like,
see, every pranayam can be, all the pranayams are good, but I will prefer Anulom Vilom. Sitali pranayam, all
okay,
these are cooling for our body. These all are cooling from our body. But all pranayams are good for our respiratory system. Every pranayam is good for respiratory system. But these two must be given more preference than others.
okay, okay,
Okay, another thing I will add, if you are experiencing epitaxis, like the not the posterior, not have experiencing epitaxis from the posterior part, but experiencing epitaxis from the anterior part, means for 2 to 3 minutes you are experiencing the nasal bleeding. You can take nasya. You can take a dip of mahish dudha, that is the milk of the buffalo and goat mixed, and uh, get them into a drop. Like take a cotton and make a drop of them to the nose. It will act a very good home remedy actually. The mixture, the
okay,
mixture of buffalo milk
okay. So, mixture
and
of buffalo's milk and goat's
buffalo
milk
milk and
will
goat milk.
very good. Okay, that can be used as a nassa in the case of emergency, like at home.
Laja and
We
Sattu
can do
also.
that.
Laja and Sattu also. This can also be very beneficial.
Okay, okay. So, is there any case study that you want to discuss? Like in the unit clinic, you must be seeing the patients with epistaxis. So, if any personal case that you want to discuss, or please tell our viewers that आपका कोई ऐसा पेशेंट हो जिसको आपने ट्रीट किया हो या ऐसा दिखा हो, उसका कुछ हिस्ट्री आप बताएं प्लीज.
Uh, I myself am a patient, was a patient of epitaxis. Yeah. But I never got this type of patient, frankly, because still now I'm just a fresher,
Okay.
I'm just a graduate. So I'm
Yeah, yeah.
started practicing. So till now I didn't get a patient of epitaxis, but when I got epitaxis, even after even after I am a doctor, even after that, I got panicked that what happened to me? Why
Yeah.
am I nose bleeding? Epitaxis? What is epitaxis? My mind was blown out clearly that what is happening to me? The whole world was seeming like black, like in that time. I was panicking too much, and for little thing, I panic a lot. So that time I was panicking, and
Okay.
panic was too much. I was panicking, and when I went to the hospital, I had no nasal plaque in my home. Nothing. Who knew that I will have epitaxis in my home? So I had nothing in my house. I had just the ice packs. If कहीं पे मतलब दर्द वर्द लग गया हो तो ice pack लगाते हैं. बस I had that ice packs. Just I hold the ice packs like this and I rushed to the hospital like this. And it was continuously bleeding. When I reached the hospital, that time the bleeding was, the blood started getting clotted. But even in hospital, when they was cleaning the clots, that time also it was bleeding. I lost a lot of blood that day. So that day only, after if you're having hepatitis, the emergency is apply the ice pack in your cheek region and in this region. This will help a lot. If you are not having posterior, if you are having anterior bleeding, instantly this will stop the bleeding instantly.
Okay, so in your case, it was anterior with upper tract infection, right? Like
My was
post-COVID upper tract
posterior
infection.
because it was not stopping even after 10 minutes. It did not stop. That is due to upper
Okay,
respiratory infection. Now that's why.
okay, okay. So like you had your attack like how many months back?
4 5 months back.
4 5 months back, around in the month of December or November, December,
November, December.
I think. Right. So what was your diet pattern for the next 15 days? Like any precise, like you
I
said, you
started
added
with
milk
Langan.
and a ghee in your
I
routine?
came back from a hospital.
Okay.
I opened the Raktapitta chapter that what is written for Nasagata Raktapitta. So I saw that it's Langan. So
Okay.
uh, I took a rest. I just slept down immediately. I tried to sleep. So I slept down that night. And after that day also, I went for complete Langan. Complete Langan. I did not eat anything. And I was not feeling hungry also because when your body is not well, actually you will not feel like eating. If you will not, you will feel very tired.
Yeah.
One who experiences epictaxis will know that how much tiredness you will feel after that. So a lot of rest is required after you experiencing epitaxis. Go for Langhan. This is very much essential. Don't over work out after you are experiencing. I went for a complete bed rest for at least 1 week. I went for bed rest because I knew that if
Okay.
again it happens, it will be more dangerous. If you're losing blood continuously, again I lost a lot of blood. Again, if I lose a blood, then my body will of course be I will be needing blood means blood transfusion then after that. So that's why
Okay.
bed rest is very much needed that time. And continuously, if you are taking that ice pack, it will help your body to cool down. It will help to prevent again the episode of epitaxis. It will not reoccur then. So I
Okay.
applied the ice
So
packs in my cheek region, in the nose region. I applied.
okay. So basically, one should not overexert for like next 15 days to avoid the recurrence of epistaxis.
Mm.
Because I see people taking it very lightly. Okay, they was a nasal bleeding that happens. They don't take it seriously. So it means people should take care of the nasal bleeding, like either inferior or posterior. They should rest for the next 15 days. So is there any particular medicine that you took, like, or you just Langan help you in the healing?
No,
Any
no.
medicine that you added in your routine?
Yeah. There are, that you told the Nakshya. I told Nakshya of Anutelo and another thing I'm going to tell the medicine which helped me. That does not mean that it will help the viewers also. Please don't take the medicine before that consult
Yeah,
an Ayurveda doctor because it helped me. That does not mean that it will help you. I know my body, I know my prakriti. That's why I took the medicine. I took Nasya
yeah.
Vantoila and Durvaras will act very good in the epitaxis. But my time I did not find Durvaras nearby shop. So I went for Anutraila only.
Okay,
And my maid
okay,
had buffalo. So I asked her to bring some few drops of buffalo milk and she somehow managed from somewhere goat's milk also. So I mixed the milk and I
okay,
took a drop every each nostril, two drops, 2 times. Same way. That helped me a lot. Anutaila is very good in epitaxis actually. It will help a lot.
okay. Or nothing, nothing like any, no oral medicine that you took.
Oral medicines for upper respiratory infection. That is not for epitaxis I told. For upper respiratory infection, I took Lakshmi Vilas and all those things. That will not act in epitaxis. That is for upper respiratory because my cause was upper respiratory infection and epitaxis was one of the complication of URTI. It was not. I
Okay,
was having the complication of that disease. That's why I took it from there. But if one is having epictaxis, there can be medicine. There are lots of medicines for Raktapitta, but for that you must consult an Ayurveda doctor. Don't
Yeah.
self-medicate. Can be very harmful.
Yes, sure. Yeah, definitely. So, any last words that you want to add in the relation to epistaxis? Like you have mentioned the causes and the types of epistaxis and some remedies also. So, if anything else that you want to add that you missed, please go ahead and add that.
Yeah. See, epitaxis is a very common term nowadays because it's becoming hot. The weather is becoming hot. After some days, suddenly it will become cold because rainy season will come. Between this season gap, epitaxis will occur. So it's gonna be very common. And for this Raktapitta, the epitaxis, the Nasagata Raktapitta, if you want to get cured permanently, like me, who I didn't have any episode of epitaxis from last 4 5 months. I did not just had one episode. After that, I did not have any episode. For that, you must consult an Ayurveda doctor. You must go for Ayurveda treatment because only taking nasal plug during the epitaxis, during the means during the bleeding, it's not going to help you. Taking a lots of antibiotic not going to help you. It's gonna help you up to some limit. But after that, you must be taking something which will cure you permanently. For that permanent cure, you must take Ayurveda and don't come after taking antibiotic. Start it from the very first day. Come to the Ayurveda doctor the very first day, start your treatment, it will get cured permanently. I'm damn sure about that.
Yeah, and I think that is why, like, as you mentioned, that overexertion is the cause of epistaxis or curd is the cause. I think that is why in Epithelius chapter it is mentioned that one should not overexert in the weather of Grishma Ritu, and one should avoid having like day sleep and having curd, in, especially in the Grishma Ritu. The curd is totally avoided in that Ritu. I think there was a signs of like they mentioned Raktapitta here and there, like if you want to avoid the reoccurrence, then they should follow the Epicharya properly.
Yeah.
So I think that my our acharyas are way too smart than us, and because they are giving us hints here and there that this is the main cause, so you should avoid having this. So yeah, it was great having you here on my channel on my page. So thank you so much for giving
Thank
you
you. I
your
am
time.
so much happy to be invited by you. And being in your life is
Yeah,
very honest.
and one thing I want to add that you are my first Bengali friend that is live on my channel. So it's great to have a Bengali friend. So, please just tell us some Bengali words, like if you want to say, how are you? So, how do we pronounce that in Bengali?
Just 1 minute. I got a question in live, I think. We got a question.
Yeah,
Yeah.
yeah, please take the question.
Anutoila is not used in Pitta Jabati. Then how it will work in Raktapitta? No. Anutoila will work in Raktapitta. You can see the reference, and I think that's I with the doctor. You can see the reference in Charles Samhita, a Raktapitta chapter.
Yeah, you can read about Anutel in the like Charak first 7 chapters also, where they are mentioned about Nasya. So, you can read about that also.
Actually, in Charak Samhita and Raktapitta chapter, there is mentioned of Nasha, of Durvadas, Ikshu, uh, Darim Puspa,
I think onion juice also.
Anyama
Onion juice
Panatu.
also is mentioned.
These all are taken.
Yeah.
These Nasha must be taken for Raktapitta. And along with another Nasha is also mentioned Anutaila. But
Okay. Yeah, I
Durvadas
will
is
look into
sign of
this. Like
treatment.
really put.
That does not mean that Durvadas will be for everyone. Yeah.
Yeah, yeah. So yes, Dr. Nayana, there is a question. Yeah, who asked the question? I will look into this again, Anutela, if it is not allowed in this. So we will answer that again if there is any problem in this. So, साम में होता है. सोम में होता है Anutel. The Vaidya Akshay Sharma has answered that Anutale is home in nature, that is why it is working in the problem of epithexis. So
Any form?
I think I am getting actually I can see the DMs here popping in my screen in which there are questions, but I can't open the DMs actually. So I will send you the questions that I'm getting in the DM so that you can answer them or you can reply them, okay, personally. Because
Yeah.
I am getting messages, but they are not typing here. Don't know why. So I will
Firstly,
send you the messages. Okay. Yeah. So okay, thank you so much
yeah.
for joining my live. Yeah. Please take
Thank
care.
you for inviting
Okay.
me. It
Thank you
was
so
great.
much. It was great having you. Yeah. And our Bengali class is left. Okay. Please teach me some words
Sure,
in
sure.
Bengali.
Sure. I will learn
Okay.
Punjabi and
Chalo.
I will make
Okay.
learn Bengali so that I
Ah,
can
yeah.
enjoy
Sure, sure.
Guru.
Yes, yes, definitely. Definitely.
Yeah.
Okay, Namsha.
Thank you.
Okay. See you soon.
Yeah. Bye.
So, if there's any question from the viewers, please type here or in the DM. Okay. So, thank you so much for joining in. There were some 7 to 10 or 15 followers. It was great to have you. And so, it is the starting of the live sessions. I hope to do more with more doctors. So, thank you so much for joining and staying tuned till the live ends. Okay, see you again in the next live.